Hello, everyone. I'm Rob Rogers, President of School Health Corporation and Board Chair of Healthy Schools Campaign. It's a real pleasure to welcome you to Change for Good on behalf of our board and staff. For more than 20 years, Healthy Schools Campaign has been dedicated to making schools healthier places for all children. I'm proud of the impact this organization has had, from advocacy to on-the-ground programs that make a real difference for students and families. At School Health, our mission is closely aligned. We provide products and solutions that help students stay healthy so they can succeed inside and outside the classroom. In my work with districts across the country, I see both the importance of student health to attendance and learning and the financial pressures that make it so challenging to meet these needs. That's why the work of HSC is so vital right now. Healthy Schools Campaign advocates for programs and policies that support public schools and center the needs of students and families. We partner with school districts across the country to prioritize the health and wellness needs of students and develop scalable programs with measurable results. This work that supports students, families, and public schools is more important than ever, and we are so pleased to have so many of you with us today from all across the country. Now, I want to thank our Change for Good sponsors who are investing in our mission at this crucial time. Silver sponsors include Blue Cross and Blue Shield of Illinois, GCM Grosvenor, Northern Trust, U Chicago Medicine. Our bronze sponsors include Advocate Children's Hospital and ECT Environmental Consulting and Technology. In addition to our corporate and foundation sponsors, financial support from individuals is critical, and I'd like to thank our HSC changemakers that have given at least a level of $1,000 or above. Your support makes this work possible. Finally, thank you all for being here today. You'll hear from environmental, health, and education leaders about the urgent challenges schools are facing and the opportunities we have to support public schools and healthy students together. Now, I'm pleased to introduce the President and CEO of Healthy Schools Campaign, Jennifer Tawney.
Welcome, everyone, and thank you, Rob, for your leadership and work to advance healthy schools. We are so grateful to School Health Corporation for being the platinum sponsor for today's event. Healthy Schools Campaign is committed to ensuring that every child has access to a healthy school environment. We all know that healthy students are better learners, and children can't learn and thrive at school if they are hungry, if their health needs go unmet, and if they're in environments that do not support their safety and well-being. That's why HSC partners with parents and caregivers, school leaders, school staff, including teachers, school nurses, and building engineers, as well as community partners, to advocate for key components to a healthy school: healthier and free school meals, comprehensive school-based health services, sustainably maintained facilities, and buildings and school grounds that provide access to nature and spaces for physical activity, learning, and play. This work is interconnected and contributes to creating dynamic and healthy public schools that make students and families feel welcome and safe. We were founded in Chicago over 20 years ago, and you'll now see Healthy Schools Campaign's impact at the national level and in states and school districts across the country. And now, the current administration's dismantling of federal safety net programs that support healthy children and families threatens work that so many of us are doing to center their needs. These policies and this current climate will result in many harms. We will see increasing food insecurity and child hunger, and schools that can no longer provide free, nutritious meals that support children's growth and learning. We will see families lose eligibility for Medicaid and parents no longer accessing health services for their children. These reductions in Medicaid enrollment will in turn reduce the ability of schools to provide health services for students. We will see worsening air quality and the harmful impacts of climate change on children's health as environmental regulations are rolled back, pollution is no longer documented, and cuts to EPA programs take effect. With the dismantling of the Department of Education, we will see many harms, including the erosion of civil rights protections for BIPOC, LGBTQ+, and students with disabilities. With the increased ICE activity at schools and communities, we will see families that are afraid to send their children to school or participate in any way in school and community life. This picture is daunting, but we know that we cannot lose hope, and there is so much for us to do together. We have a wonderful Change for Good program for you today, full of tough realities and challenges, yes, but we will also find inspiration in the incredible work that our speakers are doing and leave you with tools and action steps that you can take to support children, families, and our nation's public schools. I'm delighted to introduce our first speaker, Dr. Jalonne White-Newsome, the former Federal Chief Environmental Justice Officer of the White House Council on Environmental Quality, CEO and founder of Empowering a Green Environment and Economy, and Associate Professor at the University of Michigan School of Environment and Sustainability. A native of Detroit, Michigan, Dr. White-Newsome has tackled environmental challenges from a wide range of positions and perspective. Dr. White-Newsome earned a PhD in Environmental Health Sciences from the University of Michigan School of Public Health, a master's degree in Environmental Engineering from Southern Methodist University, a bachelor's degree in Chemical Engineering from Northwestern University, and a certificate in Diversity and Inclusion from Cornell University. Affectionately known as Dr. J, she remains most thankful for her main job, being a wife and mother to her daughters, Ariel and J. Anna Lynn. Please welcome Dr. Jalonne White-Newsome.
Awesome. Thank you so much, Rob, and thank you, Jennifer, for the kind introduction and your leadership. As mentioned, my name is Dr. Jalonne White-Newsome, and I am honored to be a part of this conversation. I first learned about Healthy Schools Campaign several years ago when I was a senior program officer at the Kresge Foundation. And I was leading a portfolio where their Spaces to Grow work was really a key part of climate resilience. And so I am so honored to be here and see the continued work and growth of the Healthy Schools Campaign. And to each of you in this virtual audience, again, representing so many different communities that I see in the chat, thank you so much for taking the time for joining us for this webinar. So in February, I was forced to resign from the White House after leading the first ever Office of Environmental Justice for the Biden-Harris administration, let me be clear. And while my federal service was transformational in many ways, the values, the experiences, and the grit that I tried to bring to 1600 Pennsylvania Avenue came from the way that I was raised and really mentored by matriarchal powerhouses that embraced this idea of a beloved community, folks dedicated to loyalty, to truth, to unity, and operationalizing love in a way that transforms lives. I come from a family of educators and advocates, from the formal classroom to the streets, creating opportunities for mentorship, and a family that has consistently advocated for children and families for over 5 decades. So growing up in Detroit, I watched my mom and my grandmother make personal sacrifices, and most importantly, use their power and privilege for good to create an infrastructure to support children and families so they could thrive. But early on, I learned that not every child had access to a safe home, a healthy environment, or even a safe school to learn and grow in. In the population of children my family and I connected with through our daycare centers and our schools that we partner with across the country, it was not uncommon for our children to have been exposed to the neurological toxin of lead and suffer behavior challenges because of that exposure. It was not uncommon that our children were displaced from their home because of the unsafe living conditions due to extreme flooding driven by climate change that made their homes inhabitable. It was not uncommon that our children came to our centers hungry because parents, grandparents, or caregivers had to make the hard decision between putting food on the table or literally keeping the lights on and keeping the water from getting shut off. It was not uncommon that our children had to miss school because it was a bad air quality day and they could not breathe easy because of their asthma, exacerbated by industrial pollution and dirty school buses. It was not uncommon that our low-income Black and Brown children that lived in certain zip codes of the city were overpolluted, overexposed, and the infrastructure they needed was underinvested in. Unfortunately, this is the daily reality that many of our children across this country live with. And that reality is only growing worse with the proposed actions of this current federal administration. Actions that are promoting fear, that are creating false solutions, and removing funding from the critical programs and services that are needed to protect our children, the most innocent victims in this time of chaos, confusion, and crisis. So what do we do as parents and educators and health providers and advocates and caregivers, or just regular old folks that care about the welfare of our children? Well, I'm glad you asked. My answer is simple, and I encourage you to lean into your ABCs. That's right, lean into your ABCs. And so what that means is that A, we have to acknowledge the intersections. B, we need to break through the noise. And C, we must commit to action. So let's begin with how we lean into acknowledging the intersections. Our children do not live in silos. In fact, their lives and our lives are interconnected to whatever they are exposed to or introduced to in the places that they live, work, play, learn, and pray. So in order for us to change children's lives for the good, we must recognize the intersections that limit access to health care, energy insecurity, food insecurity, exposure to environmental hazards, and climate change, and many more. All these things that collectively contribute to the unhealthiness of our children. So we can't address just one issue without addressing the other. And I believe that we cannot have healthy children unless we manage all of the elements that contribute to what the Centers for Disease Control calls the whole child framework. For example, I've worked to address environmental racism for the past 30 years, and through my advocacy and research, working to protect low-income communities of color and indigenous communities from having to live in bad environments. When we talk about this in the environmental justice world, we use a term called cumulative impacts. And that is basically saying the reality that exposures and impacts don't hit us one at a time, but oftentimes they come at the same time on the same communities that continue to be overburdened. So in order for us to actually achieve environmental justice, we have to attack the whole ecosystem. We got to make sure that we have strong environmental protections. We got to make sure we have folks that have access to healthcare when they need it. And we got to make sure that folks have the resources to do more than survive, but thrive. And this is a parallel theory of change for our children. We must acknowledge the intersections by supporting and creating policy, developing programs, and funding interventions that strengthen the whole community so we can protect the whole child. Secondly, we must break through the noise. My oldest daughter plays collegiate volleyball, and I am always impressed by how she can concentrate amidst the madness and noise in the gym, particularly from the opposing team and the crowd. And I posit, my friends, that in our current environment, there is a lot of noise going on, psychological noise meant to distract, to cause anxiety, to get us off our game. This noise, even more amplified because of the biases, the prejudices, the closed-mindedness, and the sheer disregard for humankind that exists and perpetuates in the many narratives we see and hear and scroll on every day. That is why these spaces like this webinar are so critical for us to grow. So we hear truth, we understand the facts, and we can move in a united direction. So there is nothing good, big, or beautiful about cutting $1.1 trillion of Medicaid, CHIP, and the marketplace, causing 15 million people to lose their insurance. There is nothing big and beautiful about SNAP funding being cut by 20%. And there's nothing big and beautiful about the continuous repeal of environmental regulations that are supposed to keep our air, water, and lands clean. So friends, we must overpower the noise, continuing to find ways to get our message across, to break through the noise with truth, love, and power, because our children cannot afford for us to stand by silently. So I urge you to connect with organizations like the Healthy Schools Campaign and other organizational allies in your community that have the real data, that can amplify the real stories of how these changes will impact our children. And last but not least, I encourage all of us to commit to action. So when I speak across the country, people often ask, what can I do? This is too big of a problem. I feel powerless, or will my voice or vote actually make a difference? Well, I firmly believe everyone has a role, not just to listen to this webinar on a Wednesday afternoon, but to actually commit to action. I've had the opportunity to coordinate several national campaigns to advocate for environmental protection over the years. And the beauty of coalitions is that every organization, every member, whether big, small, black, white, big budget, little budget, from New York to Texas, every member had something to contribute. And so your commitment to contribution is essential to helping us achieve our shared vision of protecting our children. And so there's 3 ways I suggest you consider in operationalizing your commitment to this cause once you leave this webinar. The first, we need to condemn the efforts to destroy the infrastructure we so desperately need. For example, calling your state representatives makes a difference. They need to know you care about preserving Medicaid for school health services. They need to know that you care about preserving the National School Lunch Program and your fear of dismantling the Environmental Protection Agency. Pressure moves people to action. And I spent enough time on Capitol Hill to see that manifest. So for my parents and caregivers and teachers and educators and business leaders, everyone's voice is important. Secondly, we need to corral some new allies and do some contingency planning now. For example, if we know there will be a potential shortage of school meals, that the availability of health services will be limited, how do we start to think proactively about who in our community is allies that we can put in place to help manage those potential gaps in services and resources? Could it be a local business that commits to providing boxed lunches? Could it be a professional society of community health workers committed to providing exams or other medical services? Could it be partnering with a legal clinic to provide legal protections for families that are being targeted by ICE? Again, this is the time to put contingency plans in place and help fill the gaps with new allies. And the third action, to any of my friends in philanthropy or those that represent foundations, is to concentrate your giving to address the immediate needs that arise. Now, I worked in philanthropy for several years, and while foundations cannot replace the government, they can certainly work to mitigate the mess this current government is making. Now, I've seen philanthropy step up, particularly during the COVID crisis, and be nimble and flexible and proactive with support. And I encourage foundations to connect with nonprofits and schools in their areas of giving to begin to co-conspire and develop a plan for giving to minimize the crisis at hand. So as I close, friends, I encourage you to remember our children do not live in silos, and we must seek solutions that protect the whole child. That includes the places our children live, learn, work, play, and pray. So I encourage you to lean on your ABCs, to acknowledge those intersections, to break through the noise and commit to action. So thank you for the opportunity to join you today. And remember, we can all be the change for good for our children that we want to see. Thank you.
Thank you so much, Dr. J, for your thoughtful remarks, for illustrating the realities of these intersecting harms on children and communities, for your leadership in advancing environmental, racial, and health justice, and for a truly inspiring call to action. I love your version of the ABCs. I'm going to remember that and say it again. Acknowledge the intersections, break through the noise, and commit to action. Thank you for giving us some concrete ways that we can all take action and do that. In addition to our work at the national level, Healthy Schools Campaign partners with states to advance a healthy schools agenda. For over 10 years, we've collaborated with state education and health leaders to bolster school-based health services through our Healthy Students Promising Futures Learning Collaborative. I'm so pleased to share brief video remarks from Lieutenant Governor Jalonne Gilchrist from the great state of Michigan on how their students and schools have benefited from this important partnership.
Hey everyone, Michigan Lieutenant Governor Jalonne Gilchrist here. Welcome to the Healthy Schools Campaign's Change for Good event. Healthy students are better learners, and public schools must provide safe and healthy environments to support student wellness and academic success. That is why, for the last 6 years, Michigan has been a member of the Healthy Students Promising Futures Collaborative. We secured per-student funding for on-campus mental health and school safety needs, opened 100 school-based health clinics, and delivered free breakfast and lunch for all 1.4 million public school students. At this crucial moment, with so many student health supports under attack, we will keep working hard to support students, families, and our public schools. Thank you.
Thank you so much for this message, Lieutenant Governor Gilchrist. Next, I'm pleased to introduce Sarah Porter, Vice President of External Affairs at Healthy Schools Campaign and Director of our Healthy Green Schools and Colleges program. Sarah?
Thanks, Jennifer. Hi, everyone. Thank you so much for joining us today. I'm very excited about the discussion we're about to have, so we are going to get started. I have the pleasure of facilitating a discussion between two very important district leaders. So we've talked about things at the federal level, we heard a message from the state level, and now we're going to focus on what's happening at the school district level. And so first, I would like to introduce Tarrah DeClemente, the Acting Executive Director of Nutrition Support Services at Chicago Public Schools. Tarrah has been with CPS for 12 years and has been working on public policy and public health for even longer than that. In her current role, she's responsible for the district's meals program that serves 325,000 students across 634 schools. I'm going to say that again, 325,000 students across 634 schools. It's huge. Tarrah is a registered dietitian nutritionist, and she has a Master of Public Health degree in Health Policy and Administration. Welcome, Tarrah. I'd also like to introduce Dr. Ron Tanimura, the Director of Student Medical Services and Medi-Cal Programs at the Los Angeles Unified School District. Not many districts larger than Chicago, but LAUSD is one of them. He currently oversees all medical, dental, and vision partnerships, as well as 19 LAUSD operated clinics, 2 school enrollment placement and assessment centers, and all Medicaid reimbursements to the district. Busy guy. Prior to this position, Dr. Tanimura served as an elementary school principal and held several leadership positions with state and national education associations. Welcome. Thank you so much, both of you, for joining us today. To get us started, I'd like to ask you, I'm going to ask you both the same question. Tarrah, I'll ask you to go first. Tell us a little bit more about your work. So often a job title does not adequately cover all the things that a person is responsible for. tell us about all the different hats that you wear and what your job really entails.
Yeah, thank you. Glad to be here. So great to go after Dr. J as well, because CPS does have a core value of supporting the whole child. And so I have spent my career at CPS in both the Office of Student Health and Wellness as well as Nutrition Support Services. And both of those offices are aimed at promoting a culture of health and providing direct services that students need to support all of the non-academic needs that they have as they come into the school day. So with nutrition support, and I know we'll go more into it, we do provide breakfast, lunch, and snack and summer meals. And right now we're doing about 1.2 million meals a week. And for anyone who knows what goes into food service, there's so many things that are from purchasing to getting the food on the plate. But I think it may surprise people just how much goes into school meals, all of the guidelines that we have to follow, all of the state policies, local policies, everything we have with contracts and day-to-day operations. We've had a ton of rain in Chicago at start of school, a lot of floods in our schools. So you just never know what'll pop up. But I think on top of that, we're also trying to appeal to our students who have a sophisticated palate. There's a lot of foodies out there. They like things spicy and salty and sweet, and we cannot do all of that in school meals. And so we're trying to be chefs. We're trying to do mass cooking. We're trying to pivot towards special holidays, different month things. So there's so many things that goes into our day-to-day, but that's what keeps it interesting. And at the end of it, of course, keeping the students and families in mind. We know that what we're doing is important. It may not always be the first thing people think about when they come to school, but it is something that we know is important.
Thanks, Tarrah. And I appreciate the way that you worded that, really thinking about all of the non-academic needs students have that need to be met in order for them even to get to the learning part. That's so important and so connected to what we're talking about today. Ron, same question for you. Tell us a little bit more about your role and all of the many things that you're responsible for.
Oh, agreed. First, I'd like to also just say great remarks from Dr. J as well. I also took notes and really wanted to move to action as well as what those recommendations were. So thank you so much for that. But in terms of LAUSD, I like to think I have multiple hats, but three major hats. So one of them is the medical side, where I oversee 17 LAUSD operated clinics. So we have our own physicians, nurse practitioners, medical assistants to provide those medical services, assessment-only services, so our students could get into school a lot quicker. We have also partnerships with FQHCs, 19 wellness centers that we built with bond dollars from brick and mortar stand-up, clinics at our high schools, where they're able to see our students, families, and the community. So we oversee that process. And we have two what we call SEPA centers, school enrollment placement and assessment centers. And that is for our immigrant families. So they come to our centers for all of the needs that they're coming with. One, school enrollment. A lot of times they don't speak the language. We'll provide that enrollment for them, as well as other social needs support. The medical needs as necessary as well. The other thing that I oversee is partnerships. All of our medical, dental, and vision partnerships, agreements, contracts, to make sure that we get them in the places that are needed most desperately. There's not enough partners out there to cover the 710 square miles that we have, but we do strategically place them in the areas of the greatest need. Another hat that I wear is the Medicaid billing. So we oversee all the Medicaid, the shop oversees all the Medicaid billing that we do in the district and get those reimbursements and see how we can reinvest them in the best way possible. And finally, the other section, and one of the other big hats that is one of the things that we're doing again is we have this initiative, We Are One, standing with immigrant families. We're changing it a little bit more around this Trump 2.0 version, just We Are One in general, because it's not just immigrant families. It's about protecting education. It's about standing up for all the things that are happening in the health ed department, like Dr. J said, and our immigrant families as well. So we're bringing in a multiple set of stakeholders and providers to help us with the constant and consistent messaging. So that's becoming more of my job around this time right now. But that's basically what my job entails.
I think that was like 7 or 8 or 9 hats, maybe, Ron, not just 3, but wow, that's a lot. And you already started to touch on the response to the next question I'm going to ask, but if you want to elaborate, I'm going to ask you to go first. I'm wondering if you want to talk a little bit more about why access to health services is so critical to student health and learning, and why schools' ability to deliver those services is more important now than ever before. So again, you kind of already started to talk about that, but is there anything you'd like to add?
Yeah. So I mean, why? The why is always the fundamental question that we start with. So I go back to my first experience as a principal when I walked into my first building. I had a Healthy Start office. And with that Healthy Start office, we attached a mobile medical van and an outlet so they could charge and see all of our students 1 day, 2 days a week. And then I also brought in mobile dental services that we had. And from that, I realized that, my students and that population that I served was in such great need that trying to maximize their learning couldn't be accomplished without meeting their basic foundational needs. So with that, I realized I can't. It's not about test score. It is about test score. We want to see success, but if we can't move the needle, we have to address it at a core foundational area. And so that's where I became an advocate. I said mental health is critical about basic needs, school enrollment and insurance and everything around immigration status. And so those are the things that we needed. And I became a strong advocate and proponent for which, I joined multiple organizations and I took the lead and went to the state and went to Washington, D.C. to advocate about those foundational components that we need to really optimize student learning and health. And it begins with health.
Thanks, Ron. Tarrah, anything you'd like to add from your perspective?
Yeah, so when you think about access to meals, I think there's so much of what Ron was saying. There's part of this work that is the right thing to do. Take all the politics out of it. And when you think about the school day, especially public school, we are not charging students for use of the textbooks, for the paper towels, for the soap, things. You're not getting charged for recess. So when you think about the meal, what makes the meals different? Why have we fundamentally set up the meal program in some where it's on a paid or reduced or free scale? And so what should just be there when students are coming in, whether on time, late, we don't know what happened. The bus didn't come, mom woke up late, all the reasons that you would just rush to school. It's so nice to think that you can start your day with that smile, with that good, healthy meal before you get into the day and get into your learning. And I think too, so much about the meals and what should be available into which populations is covering up the other I'm a parent, I have 2 young kids. There's a practicality to having school meals, just to not have to worry, what is my child going to be eating today? Whether you can afford to send food or not. What can we take? Parents are busy as well. Parents are working one job, multiple jobs. They're running kids to different schools. To be able to take that burden off of families when they're already trusting us with their students, with their children, how can we also just say, hey, we're also going to have these great healthy meals that your students can influence through surveys. They can tell us what they want to eat, things that they don't want to eat, and also meeting all of these other requirements. So when I think about the meals and how they have become this political discussion as a separate idea, we are not having this separate inclusion of services parsed apart in other places like we are with health services and with meals. Students spend so much of their time with us. Parents trust their schools. These are safe spaces. Schools are working harder than ever to have all of the services students would need right there within that day to take away some of that burden for parents to, now I have to leave school and get to another appointment. Now I have to leave school and pick up things to pack lunches tomorrow. No, we've got that. And we can have a hot meal in the middle of the day. Food creates community. So thinking about that space in schools where students get to just talk and be themselves. There's so much more than just the food on the plate. And I think if we could cut through all of the noise and think about basic human survival, we need food to survive. And we need community to have a good, fulfilling life. And so school meals should just be considered as part of the school day. End of story.
Thank you. I appreciate that end of story. Like nothing else. There's nothing to add to that. That should be the end of the story. Tarrah, I've, as you know, been leading HSE school advocacy work for a really long time and have had the opportunity to work closely with you and other food service directors across the country. It still never fails to amaze me how complex and logistically challenging serving school meals really can be, especially on the scale that Chicago Public Schools is doing it. You touched on this a little bit already, and I know I'm going to ask you some questions about procurement specifically in a minute, but can you tell us a little bit more for folks that are not in the school food world? Give us a little bit more about sort of what really is involved in serving meals. You said, I think, I wrote it down, 1.2 million meals a week. Tell us more about that.
Yeah, so we do have 2 contracted vendor partners that help us with our meal programming. So we have our schools assigned in that way based on their kitchen abilities. So I would say also thinking about public schools, we have aging buildings and new buildings. New beautiful buildings have new beautiful kitchens. We have one of the oldest schools in Illinois, I think, James Ward, and that is it's still a functioning kitchen, but when you think just about the scale of the buildings we have. So we do vary our menu just a little and our service model. We don't vary our menu as much as our service model. But we have schools that in that school, the wonderful, amazing, committed dining manager and dining staff are placing their food orders, they're keeping their inventory, they're making sure things are coming in on time, they're following all the recipes, they're doing production records, keeping track of temperature logs, all of the things that go into food service, and they are actually preparing food on site. Some things from scratch, some things that are a little bit partially made. We call it fast scratch, unpopularly called ultra processed. So I know we'll get a little into that. But when you just think about the scope and scale, and the abilities, we do have to have some things that come in a little bit partially made. And then we have schools that just receive meals, whether they receive kits already made that the students individually get, or they get a bulk site. That also varies just again on the equipment. And so we're managing operation models, ordering of food, delivery of food, and then all of the equipment is also CPS owned and repaired. So that's something that every day there's unfortunately at least one email where something went out, the refrigerator or the freezer or the warmer. So that's also part of what we're day to day looking at. And so 1.2 meals, I think even if you thought of, I wish I could say which means 7 million baby carrots or something, it's just the amount of food that actually is in those. Entree, milk, a fruit, a veggie. It's a lot of food when you think about it.
It is a lot of food. And between the nutrition requirements set up by the National School Lunch Program, the reimbursement rates, there's certainly budget constraints. You mentioned earlier the sophisticated palates of students that are looking for spicy and salty and sugary things. And then your challenge of serving meals that fit that budget and the nutrition requirements and are appealing to students. It's not an easy feat by any measure. I know CPS has done a lot of area in this work. What opportunities do you see to continue to expand on your work to serve nourishing, less processed, healthy school meals that students want to eat?
Yes. So I came on that they want to eat is the key part because we do need participation to continually fund this program since it is not automatically part of school. So I came to CPS during the Obama administration when there were so many wonderful changes to the dietary guidelines that had not been updated, or the school meal guidelines that hadn't been updated in a while. So adding all those red, green veggies, the whole grains, that taking out a lot of salt and sugar, there was a big arc of learning that had to happen with, we are famously known for butter cookies. I did not grow up here, but I can tell you that everyone asks me to put the butter cookies back on, which we cannot, sadly. So, we went first to the nutrition guidelines, but then all the other parts about food sustainability. We have been working on with the Healthy Schools campaign, ingredients of concern for over a decade. And so now even having the MAHA movement say, get all of these ingredients out of kids' food. Yes, we have been trying to do this for 10 years. So come along. But then some of the other things we're trying to balance, like buying more American, and there are just things kids love, like bananas, that do not grow here. So there's so many conflicting changes that are happening that we're trying to keep up on. But we do a student survey every year. Last year we had 40,000 responses. So people are very passionate about the school meals that they're getting. And we do just try to use data. We try to appease our students. We have such a diverse, amazing tapestry of students from all over the world. And so we try to have different flavor profiles. We try to spotlight, it's Hispanic Heritage Month. So we're doing a couple special serves around that. So we do just try to keep the menu interesting. And then we do have different sauces and spices and things that the school's dining manager, who knows their students the best, can actually pick to go to those palettes.
Thanks, Tarrah, for helping paint that picture for everyone. That's a lot of stuff. We're going to pause on school food for a minute. Ron, I'm going to ask you a couple of questions. So this new federal budget law that cuts over $1 trillion in Medicaid funding. So these reductions are not going into effect yet, but we know that the Medicaid cuts will have a significant impact on schools in the future. So that we can all better understand how these cuts will impact districts, can you share more about how LAUSD uses Medicaid funding now?
Yeah, sure. So we generate over $40 million annually in Medicaid reimbursements. It's quite a large amount of money, but these funds are reinvested in student health services and schools and clinics throughout our district. Also goes back to special education for utilizing the services, supplemental services that they could spend it on. But in addition, we use these funds to expand like innovative practices and services that we hear from the field that mean things to teachers and students. For example, some of our Medi-Cal reimbursements that we receive will go to fund pickleball courts at select high schools, because we heard from the adapted PE teachers that we want inclusion activities that really will include the non-disabled peers. So here's something that's big. I don't know why in Southern California, I don't know if it's around the nation, but pickleball is huge. And so our kids pick it up. And this is the thing. So we're going to build 12 courts at this middle school, another 12 courts at another high school, with willing adaptive PE teachers that are out there, and they're saying, hey, I know the rules, we set them up and we'll get them in their PE classes. So it's all about inclusion and the reality of really just interacting with the non-disabled peers, or something that all teachers really want to see. Special ed teachers want to see their students thrive in. And so without these dollars, we're losing core services, supplemental services that we have, psychiatric social workers, Healthy Start navigators that we have, our clinical staff that we have. They're all funded through Medicaid dollars. And so without them, it's going to be a real tough season of trying to figure out who's more important. And we hate to value that, but it's going to like come down to it. We have to figure out where we could have our resources invested in with these cuts that are coming down the pipeline. So it's going to be a real challenge.
Well, to answer your question, yes, pickleball seems to be a thing everywhere. It certainly is here in the Chicago area. But that's really, that's incredible that you're able to use money for really exciting investments like that. Could you also talk a little bit about how those reimbursements are being leveraged to support mental and behavioral health services in school and substance use prevention.
Yes, yes. Without even going, before I even go into that, I just want to say that it's not just HR1. There's the CMS guidance that we have as an expansion state that we have to backtrack and fix the things that just came out with that guidance that really will impact our funding as well as our state economy. Don't know how your states are doing over there, but California is not doing too well. So we're losing our state resources as well. But with that said, some of the things that we've done through the Section 115 Medi-Cal waiver is we created this one program, the CYBHI, Children's and Youth Behavioral Health Initiative, something that my colleagues on the other side, mental health, they oversee that. But one thing that we're able to do is we're able to draw down Medicaid and private insurance for school-based mental health services. So that's innovative practices where our providers, once they enroll, they submit the claims to a fiscal intermediary, and then they figure out which of the insurance, who to bill, how to do it, send the checks back to the districts. And so that way is our state is shifting how we fundamentally utilize and bill and pay for mental health services in schools. So I think that's a great practice that we're doing in California, and kudos to our state Medicaid agency for coming down with that process. In terms of substance use, it's the same thing that aligns with substance use, but I wanted to talk a little bit about what our county has done to partner with LA Unified. We've utilized the county funds, their substance abuse prevention and control funds, to create what we call well-being centers. So we have 27 well-being centers in our high schools funded by the county in partnerships with Planned Parenthood to provide clinical services, tier 1 mental health, behavioral health issues, and substance abuse, getting the Narcan trainings for the opioid issues that we have going on, talking about teen pregnancy health and those issues with the experts that we know our partners at PPLA are prepared to do and have those conversations. We supplement a lot of these resources and these centers with Medicaid funds too. So leveraging these dollars are so critical to the continued success, because just putting things there, you find that there are gaps and there are needs that could truly mean the difference in a successful wellbeing center versus one that just exists without the coordination and the content behind it. So supplementing all of these services at these 27 schools with Medicaid dollars is really beneficial to everyone.
Awesome. Thanks, Ron. And keeping an eye on the time, and there's a couple more questions I want to be sure to get to. But I do want to ask you if you could just quickly tell me, this is so interesting. LAUSD has a really unique approach to ensuring that Medicaid funds are distributed in a transparent and collaborative way. Can you just quickly tell us a little bit about that?
Yeah, I discussed this a little bit last year about our state. First of all, with the support of the state, they identified one pot, our biggest pot, LA Billing Option, the Billing Option Program, as restricted. It's general fund, but restricted dollars. And they they made it restrictive by making sure that we have what's called a collaborative. County agencies, outside entities come together, and we have to present every LA BOP dollars to the collaborative to vote on. And so we submit a comprehensive package, an application, a grant application award, and it goes out through all of our student health and human services, previous division, folks who build Medicaid. And the collaborative goes through that process, and they vote, and they provide the approval, the seal of approval of yes, we will approve this, or no, we don't agree with it. And so with that, we created guidelines through the process, and that really helped protect our Medicaid dollars to really ensure that it's going to those areas where the collaborative deemed to be appropriate. So, we don't get what we want all the time, but I think that's the greatest part of our democracy, and just having those diverse perspectives say yes, no, or why would you even want to build pickleball courts? That's crazy. So we have those conversations, and I think it's a great example of just how we work together with multiple different viewpoints, being transparent, and also telling the district, I'm sorry, district, hands off, these are restricted dollars.
I love that. That's awesome. And such an inclusive and collaborative process. Very cool. Thank you for sharing that. Tarrah, I want to ask you about the community eligibility program. So CPS has been serving free meals to students for more than a decade. Can you talk a little bit about what's been gained through CPS's participation in that eligibility program, and what now is at risk of being lost potentially?
Yes, I'm so glad as Ron was talking, I'm like, I hope I get to show the link between Medicaid and school meals. So we have had amazing success with CEP. So when you think of first and foremost, there's a bureaucracy part of school meals. So when you're not eligible for CEP, there's a lot of just paperwork around eligibility, families turning in documents to show their income levels, who gets free meals, who gets reduced, who gets paid. So there's a lot of bureaucracy as part of a non-CEP program. And then there's the human part, which is now meals are free for everyone. So yay, access to high quality meals, but also really reduce the stigma. And we saw immediately higher participation at our high schools, because usually it would be something on your student ID that would show if you were free, reduced, or paid. And students didn't want people to know they were on free or reduced. There's a pride there, of course. And so a lot of students were just foregoing meals versus having it be found out they were the free or the reduced or otherwise. So we saw increase in participation for that as well. And then also we were losing a lot of money because students who were on paid or reduced, parents weren't always sending money. It could be sporadic. And we were never a district that did lunch debt. We never gave a secondary menu if you should have paid and you had no money. So we were giving full reimbursable meals to all students, whether or not they were paying anyways. So we were paying for them essentially as a district. So we saw, of course, an increase in revenue. That's kind of tailed off now with all the tariffs and all of the increase in just labor costs, and life is more expensive now, inflation, things like that. So we saw definite benefits there. And I think what is important to know is that the threat to community eligibility, besides that, of course, it could just go away. It could, of course, in any of these executive orders, we've seen things go in one day. But these changes to eligibility for public safety net programs, that is how we actually can show that we qualify for CEP. So we have to do our own back-end data to say we have X amount of students on Medicaid, X amount of students who are in foster care, who are homeless, eligible for SNAP, and we use that data to show we have this threshold of poverty in the district that would make it that all students could eat for free. And so as the policies come in and make that tighter and say who can participate in these programs and who cannot, there is a direct threat to this eligibility provision where if you're no longer eligible for any public aid because you are an immigrant, we would lose direct certification for that student. And so if we then don't have our threshold of that we need to meet, we would end up losing that credentialing as a district. And so it's all intermixed. And I think people just really understanding that maybe you're not super passionate about school meals, but you're passionate about Medicaid, please know you're also helping kids eat at school when you're passionate about Medicaid, and vice versa. You're passionate about school meals, got to be passionate about all these safety net programs. And I think what's just hard generally being in a school district right now is that everything is coming, it's so fast, it's so many things, it's so many changes. And then you're trying to figure out what are the local protections that we can exercise to make sure we are not harming students, that executive order is not harming students, and then that we don't have to execute it. So there's so many things going on, but I think people just understanding that all of these threats to public safety nets are going to impact also what students can get at school.
Thank you for making that connection, Tara. It goes back to what Dr. J was saying earlier about so often these things don't hit one at a time. They layer on and impact the same families and same communities. So thank you for making that connection for us. We have like just one quick minute left. Ron, could you just tell us quickly, how are you specifically supporting immigrant students and families right now?
So again, I think I mentioned that we have a collective district office that created the We Are One campaign 2.0. And so we are meeting with our outside entities, legal partners, and government agencies to have one consistent and common message of how to get and access the resources and support necessary. And also, the Medicaid dollars, we're funding $9 million in Healthy Start Navigators, and they are the school site people that provide all of the support systems and refer them to the locations that they could seek if we can't do it internally. So yeah, tremendous nonstop ongoing support for our immigrant families is important.
Awesome. Thank you both. I know we ran these questions a little long. It's so much I wanted to talk to you about. Thank you so much. The last question I have for you both, if maybe you would be willing to answer in the chat, is what would you tell people to do? People who want to help and take action, what direction would you give them? I'm going to welcome Jennifer back to close us out before we're completely out of time. But thank you again, Tara and Ron, for your participation today. Really, really appreciate you.
Thank you.
Thank you.
Thank you so much, Tara, Ron, and Sarah, for shedding light on what school districts are experiencing in this moment and for the care with which you are navigating such complex programs and services that you oversee. We can't maximize academic success without ensuring students' basic foundational needs are being met. So you've heard today that there are many intersecting issues, and we need your support to take action and ensure that we provide safe and healthy spaces for our children in public schools. So we're asking for three things: stay informed, get involved, and raise your voice. Whether it's advocating for policies that support student health, connecting your organization or school district with a resource, linking up with other organizations, or sharing information with your network. At this time, when our social safety nets are being severely weakened, funding for public schools is being diverted, and our most vulnerable communities are being targeted, we must all raise our voices and get involved. And I know so many of you are already doing amazing work at the state and national levels and in your communities. I'm so inspired by everyone joining us today. And so let's get involved, stay involved, support each other, and spread the word. Please see the link to our advocacy action webpage in the chat, and we'll share that in a follow-up message as well. And as we wrap up, Healthy Schools campaign relies on the generous support of our donors to continue working towards our vision of every child having a healthy school environment. This year, we're raising to a $2.6 million need, and we're grateful for everyone that is able to join us. We invite you to support this work with a contribution today using the donation link in the chat. Thank you so much for participating in Change for Good and this important conversation about the roles we all play at the local, district, state, and national levels in ensuring every child has the opportunity to learn in a healthy and supportive environment. I want to thank our speakers and guests for a dynamic conversation, and once again, thank the Change for Good sponsors, the Healthy Schools Campaign board and team, for all that they do to make schools healthier places for all children. Thank you so much, everyone.